Good day, folks. I'm Dr. Zoe Mitchell, and I've been working as a urologist here in Sydney for over 20 years. Last Tuesday, a 68-year-old bloke walked into my clinic looking absolutely shattered. He'd been dealing with erectile dysfunction for months, constant dribbling after taking a leak, and his prostate was giving him hell. After a thorough examination and having a proper yarn with him, I discovered something that floored even me after 2 decades in this field. The root of his problems wasn't age, wasn't genetics, and it wasn't even his blood pressure meds. It was 7 simple mistakes he was making every single time he masturbated. And here's the kicker. He had no bloody idea he was damaging his heart, his prostate, and even his sensitivity down there. Now, I know what you're thinking. Dr. Zoe, masturbation? Really? At my age? And mate, that's exactly the problem. We've made this topic so taboo that blokes are literally hurting themselves in silence. Look, I get it. It's awkward. It's not something you chat about over a beer at the pub. But after treating hundreds of men over 60 who are suffering from preventable issues, I reckon it's time we had an honest conversation about this. The thing is, your body changes after 60. What worked for you in your 30s and 40s doesn't cut it anymore. Your cardiovascular system isn't as robust. Your prostate's getting bigger, your skin's more delicate, and your nerve sensitivity is different. But most blokes keep doing exactly what they've always done, and that's where the trouble starts. So today, I'm going to walk you through the 7 most common mistakes I see in my practice, mistakes that are secretly causing serious harm. And more importantly, I'm going to tell you exactly how to fix them. Because here's the truth. Masturbation at your age isn't just okay, it's actually beneficial for prostate health, stress relief, and maintaining sexual function. But only if you're doing it right. Before we dive in, let me be crystal clear about something. I'm not here to judge anyone. I'm not here to tell you what's moral or immoral. I'm here as your doctor, as someone who's seen the medical consequences of these mistakes, and as someone who genuinely wants to help you maintain your health and quality of life well into your 70s, 80s, and beyond. Right, let's get into it. Error number 1. Masturbating while sitting down, especially on the toilet. I had a patient, Jim, a 72-year-old retired electrician from Parramatta. He came to me complaining about constant pressure in his pelvis and post-void dribbling. Every time he'd finish taking a leak, he'd dribble for another minute or 2. Bloody embarrassing, he said, especially at the bolo with his mates. After some questions, turns out he'd been masturbating, sitting on the dunny for years. Thought it was convenient, easy cleanup, you know? Here's what most blokes don't realize. When you're sitting, especially on the toilet, you're putting enormous pressure on your pelvic floor and your prostate. Your prostate sits right there between your bladder and your penis, and when you're seated, it's getting compressed. Now add the act of masturbation, the muscle contractions, the straining, and you're basically squeezing the life out of your prostate for 15-20 minutes at a time. Over the years, this causes chronic inflammation. Your prostate swells up, which puts pressure on your urethra. That's why you get the dribbling, the weak stream, the feeling like you can never fully empty your bladder. Some blokes even develop chronic pelvic pain syndrome, and let me tell you, that's not something you want to deal with. The solution? Stand up, mate. Or lie down. Give your pelvic region some bloody space to breathe. If you're standing, gravity actually helps with blood flow and reduces pressure on your prostate. If you're lying down, you're taking all that compression off. Trust me, your prostate will thank you for it. Jim switched to lying down, and within 6 weeks, his symptoms improved dramatically. He reckons he should have come to see me years ago. Error number 2. Rushing through it like it's a chore. Look, I get it. You're busy. You've got grandkids to pick up, lawn to mow, bills to pay. But treating masturbation like it's just another item on your to-do list is a huge mistake, especially after 60. When you rush, your body doesn't have time to properly respond. Your heart rate spikes too quickly. Your blood pressure shoots up, and you're putting unnecessary strain on your cardiovascular system. For blokes your age, especially if you've got any heart issues, this can be genuinely dangerous. I've had patients end up in emergency because they rushed things and triggered chest pain. But it's not just about your ticker. When you hurry, you're also training your body to respond to quick, intense stimulation. Over time, this can actually make it harder to maintain an erection during partnered sex because real intimacy doesn't work like that. It's slower, it's more gradual, and if your body's only conditioned to respond to quick, aggressive stimulation, you're going to struggle. Plus, and this is important for prostate health, when you rush to climax, you often don't fully empty your seminal vesicles and prostate. That fluid needs to be completely expelled, otherwise it can build up and cause inflammation and discomfort. So what's the fix? Slow down, mate. Give yourself at least 15 to 20 minutes. Make it about the experience, not just the destination. Your body will respond better, you'll put less strain on your heart, and you'll maintain better sensitivity overall. Think of it as self-care, not a race to the finish line. Error number 3. Using pornography excessively. Right, this is a big one, and I know some of you are going to push back on this. But hear me out, because the science is pretty clear. I ask almost every bloke who comes into my clinic with sexual dysfunction issues one simple question. How often do you watch porn? And the answers are usually somewhere between daily and multiple times a day. Now, I'm not here to moralize about pornography. What consenting adults choose to watch is their business. But from a medical perspective, excessive porn use after 60 causes some serious problems. First up, it affects your cardiovascular system. Studies have shown that watching pornography raises your heart rate and blood pressure significantly, sometimes as much as vigorous exercise. For a bloke in his 60s or 70s, especially if you've got high blood pressure or heart disease, that's putting unnecessary stress on your ticker every single time. But here's the bigger issue. It completely desensitizes you to real intimacy. Pornography shows you a version of sex that's not realistic. It's exaggerated. It's edited. It's fantasy. When you consistently masturbate to this kind of extreme visual stimulation, your brain starts requiring that level of intensity to get aroused. Then when you're with an actual partner, or even just masturbating without it, your body doesn't respond the same way. You struggle to get or maintain an erection. Not because there's anything physically wrong with you, but because your brain's been rewired to need that intense visual input. I had a 65-year-old patient, Trevor, who came in absolutely devastated because he couldn't perform with his wife anymore. They'd been married 40 years, had a great relationship, but suddenly he couldn't get it up with her. Turns out he'd been watching porn 3-4 times a day during lockdown. We worked on gradually reducing his porn consumption, and within a few months, his function with his wife returned. He told me it saved his marriage. The solution isn't necessarily to quit cold turkey for some blokes, that works, but for others it's too drastic. Try cutting back gradually. Maybe limit it to once a week instead of daily, or try masturbating without it sometimes. Use your imagination. Your brain needs to relearn how to get aroused by realistic stimuli, and the only way to do that is to give it a break from the super stimulus of porn. Error number 4. Using too tight a grip. This is what we call death grip syndrome in the medical community, and it's incredibly common in older blokes. Basically, over the years, you've been gripping tighter and tighter to maintain the same level of sensation because your nerve sensitivity naturally decreases with age. But here's the problem. By gripping too hard, you're actually making the problem worse. When you use an overly tight grip, you're compressing the blood vessels in your penis, which reduces blood flow. Over time, this can damage the delicate tissue and make it even harder to achieve and maintain natural erections. You're also putting strain on the penile ligaments and can cause microtrauma to the tissue, which leads to scarring and reduced elasticity. Plus, just like with rushing or porn, you're training your body to only respond to this intense, unrealistic level of pressure. Then when you're with a partner, no natural stimulation can match that pressure, and you can't perform. The fix? Loosen your grip, mate. Use a much lighter touch than you think you need. Yeah, it might not feel as intense at first, but give it time. Your sensitivity will gradually return. Some blokes find it helpful to use lubricant, which allows for a lighter grip while still providing good sensation. Others switch hands or use different techniques to retrain their response. I know it sounds counterintuitive, you're thinking, but Dr. Zoe, if I use a lighter grip, I won't feel anything. Trust me on this one. Within a few weeks of adjusting your technique, your natural sensitivity will improve, and you'll actually get more pleasure from less pressure. Plus, you'll find it much easier to respond during partnered sex. Error number 5. Ignoring lubrication. Blokes, I cannot stress this enough. As you age, your skin becomes thinner, less elastic, and more prone to damage. The skin on your penis is particularly delicate. If you're masturbating without proper lubrication, especially with a tight grip, you're creating friction that can cause micro tears in the skin, leading to irritation, inflammation, and even infection. I've had patients develop balanitis, that's inflammation of the head of the penis, because they've been masturbating dry for years. It's painful, it's unsightly, and it can actually scar the tissue, making sex uncomfortable permanently if left untreated. Plus, dry masturbation is more likely to cause the death grip syndrome I mentioned earlier because you need more pressure to overcome the friction. With good lubrication, you can use a lighter, gentler touch and still get plenty of sensation. Now, I know what some of you are thinking. Lube is for Sheilas, not for blokes. Using lubricant is basic self-care, like moisturizing your skin or using sunscreen. It protects your tissue and enhances sensitivity. It's a win-win. Get yourself a good quality, water-based lubricant from the chemist. Don't use soap, don't use shampoo, and for the love of God, don't use household items. I've seen some horror stories from blokes who got creative with what they had lying around. Just get proper lube. Your penis will thank you, and you'll actually enjoy the experience more. Error number 6. Not fully emptying during ejaculation. This is a mistake I see constantly. And it's directly linked to error number 2, rushing. When you rush to climax, you often don't give your body enough time to fully expel all the seminal fluid from your prostate and seminal vesicles. Your prostate produces fluid that makes up a significant portion of your semen. When you ejaculate, that fluid needs to be completely emptied out. But if you're rushing, or if you're stopping stimulation the second you start ejaculating, the contractions aren't strong enough or long enough to fully empty everything. Over time, this retained fluid can cause inflammation, discomfort, and even increase your risk of prostatitis infection of the prostate. I've had blokes come in with chronic pelvic pain, and when we investigate, it's often because of incomplete ejaculation over years. The fluid builds up, becomes stagnant, and causes inflammation. The solution is pretty straightforward. When you ejaculate, don't stop stimulation immediately. Keep going gently through the entire orgasm, allowing all the contractions to fully complete. You want to make sure everything's been expelled. It's not about having a longer orgasm, though that's a nice bonus. It's about ensuring complete emptying for your prostate health. Also, make sure you're well hydrated. If you're dehydrated, your seminal fluid is thicker and harder to expel completely. Drink plenty of water throughout the day, not just before or during. Error number 7. Ignoring your body's signals. This is probably the biggest mistake of all, because it underlies most of the others. Your body is constantly giving you feedback, pain, discomfort, reduced sensitivity, difficulty achieving or maintaining an erection. And too many blokes just ignore these signals and push through anyway. Look, your body after 60 is not the same as it was at 30. That's not a bad thing, it's just reality. Your refractory period, the time you need between ejaculations, is longer. Your arousal might take more time. Your erections might not be as firm as they used to be. All of this is normal. But when you ignore these signals and try to force your body to perform like it did decades ago, you're setting yourself up for injury and dysfunction. If masturbation is causing pain, stop and reassess your technique. If you're noticing decreased sensitivity, don't compensate by gripping harder or watching more extreme porn instead. Take a break and let your sensitivity return naturally. If you're struggling to maintain an erection, don't just power through, talk to your doctor, because it could be a sign of an underlying health issue like cardiovascular disease or diabetes. Your body is trying to communicate with you. Listen to it. Adapt your approach. Be patient with yourself. This isn't a competition, and there's no prize for ignoring pain or discomfort. I had a patient, Frank, who ignored pain in his pelvic region for 2 years because he was embarrassed to talk about it. By the time he finally came to see me, He had severe chronic pelvic pain syndrome that required months of physical therapy to resolve. All because he didn't want to admit something was wrong. Now, I know some of you are sitting there thinking, right, Dr. Zoe, that's all well and good, but what about erectile dysfunction? I'm doing everything right and I still can't get it up. And that's a fair question because ED is incredibly common in blokes over 60%. Of you will experience it to some degree. Here's the thing. The mistakes I've outlined today can contribute to ED, but they're not the only causes. ED can be caused by cardiovascular disease, diabetes, low testosterone, medications, psychological factors, or a combination of these things. If you're experiencing persistent ED, you need to see a doctor, preferably a urologist, for a proper evaluation. There are excellent treatments available, from lifestyle modifications to medications like Viagra or Cialis to other interventions if needed. But I can tell you from experience that fixing the mistakes we've talked about today often improves erectile function significantly. Better blood flow, improved sensitivity, reduced performance anxiety, all of these help. So even if ED is an issue for you, implementing these changes is still worthwhile. I also want to address something for those of you who are in relationships. Some of you might be wondering, should I be masturbating if I have a partner? Does this apply to partnered sex too? And the answer is yes to both. Masturbation is healthy and normal. Even if you're in a relationship, it's a different kind of experience than partnered sex, and it serves different purposes. It can help you maintain sexual function, reduce stress, and understand your own body better, which actually makes you a better partner. And yes, many of these principles apply to partnered sex as well. Don't rush, use lubrication, pay attention to your body's signals, and communicate with your partner about what works and what doesn't. Sexual intimacy after 60 can be just as fulfilling as it was when you were younger. It's just different, and that's okay. Look, I know this has been a lot of information, and some of it might have been uncomfortable to hear, but here's what I want you to take away from this. Taking care of your sexual health is part of taking care of your overall health. It's not selfish, it's not dirty, it's not something to be ashamed of. It's as important as eating right, exercising, and getting enough sleep. You don't have to implement all 7 of these changes at once. Pick 1 or 2 that resonate with you, start there, and build from there. Maybe you start by using lubricant. Maybe you commit to slowing down and taking your time. Maybe you cut back on porn consumption. Whatever it is, make a change, because I promise you, your body will respond positively. And if you're experiencing any persistent issues, pain, difficulty urinating, erectile dysfunction, reduced sensitivity, please come and see a doctor. Don't wait 2 years like Frank did. These problems are treatable, but the longer you wait, the harder they are to fix. I've been practicing urology here in Sydney for over 20 years, and I've seen thousands of blokes come through my clinic. The ones who do the best, who maintain their sexual function and quality of life well into their 80s, are the ones who take proactive care of their health, who aren't afraid to make changes, and who listen to their bodies. You deserve to feel good. You deserve to maintain your sexual health and function. You deserve to enjoy intimacy with yourself or with a partner, without pain, without dysfunction, and without shame. And the good news is, with a few simple changes to your technique, you absolutely can. So there you have it, folks. 7 mistakes that are secretly harming blokes over 60, and 7 solutions that can make a real difference. I hope this has been helpful, and I hope it's encouraged you to think about your own habits and whether any changes might benefit you. If you found this useful, I'd love to hear from you in the comments. What surprised you most? Are there other topics related to men's health after 60 that you'd like me to cover? Maybe something about prostate health, or testosterone, or maintaining sexual function as you age? Let me know, because I'm here to help. And if you know another bloke who might benefit from hearing this, share it with him. We need to break down the stigma around talking about these issues, because silence literally hurts. The more we can have open, honest conversations about sexual health, the healthier we'll all be. Right, I'll leave you with this. Your body has served you well for 6, 7, 8 decades. It's carried you through life, through challenges, through joys and sorrows. It deserves your respect, your care, and your attention. Don't take it for granted. Listen to what it's telling you. Adapt when you need to. And never be too embarrassed to seek help when something's not right. Cheers, and take care of yourselves out there.